Dr. Chait, Kinetic Rehab and Spine. Welcome to our channel. Click the link below to subscribe, share, and like our videos. Join today, join the movement, gain access to insiders' education on how you become a better you. Welcome to your destination of health and wellness. All the best. Sempre Avante. Always forward. Hi, Dr. Chait here from Kinetic Rehab and Spine. I want to open up the upper cervical vertebra for you. Now, this is a very simple stretch to do at home. Getting into position, you want to make sure the feet are turned out. You don't want the feet turned in. So I'm going to lie down in 90-90 like this. Feet are turned out. Automatically, it's going to put myofascial tension from my feet all the way up to my back. From here, tuck your chin down. Now, if you start arching your back, bring the knees up tighter. Now, this is going to be for the upper cervical spine. So from here, we're going to actually bring our hands down, turn the palms out. And if you'll notice, what happens to my shoulders, they actually come together a little bit. And I want to drive my palms away. Now from here, keep on looking down at your feet. Keep on looking down at your feet and breathe from your nose. Inhale, exhale from the nose. And this is 100% tension at all times. It's not a passive stretch, it's actually an active stretch. And keep on rotating, keep on bringing the wrist up towards you, or towards the floor, I should say. Good, and repeat that. And what you'll feel is this: not only will you feel stretch, but you feel muscles being active, like deep muscles being active, like into your feet, into your shoulders, into the deep neck flexors of your neck. Now, what I want you to do is take this nice and easy. Don't go 100% all out into this, gently go into it. Meaning this, what you might want to do is bring one leg up, second leg up, one arm down, okay? Especially if you have acute pain. Take it nice and easy, and if you have any questions, call the office at 201-327-1990. Sempre Avante, always forward.